Hi, this is Chuck. Welcome to our video question of the week. This week's question comes in from Alan out in California, and he writes, do you think some member companies will completely get out of providing health insurance for their employees when the new regulations kick in 2014? Well, Alan, sadly I do. I think that's going to be exactly what we see, and especially for companies that have fewer than 50 employees. The smaller companies, I think, will pretty much phase out of that and try to, stabilize their insurance costs by moving people over into the exchange. NSCA, we tried to do that. We tried to create a health insurance pool for our members, and because of these regulations that we see coming forward, we simply couldn't help stabilize our members' health care insurance costs because of all the new regulations, and we would be just like any other provider having to raise the rates so high that people couldn't afford our plan anyway. So those regulations pretty much destroyed the plan concept that we had, so we couldn't do it. I'm hoping that other insurance companies are able to figure out how to continue to provide health insurance for our members at affordable rates, but time will tell on that. I've spoken with several smaller companies already, since the election, and talking to them about what they're going to do. And what I'm hearing from them is that many of them intend to calculate what the cost is of providing a single employee plan for their employees today, and then starting in 2014, just adding that dollar amount to their salary, basically, to their paycheck in the form of compensation, and then leaving them to find the exchange in their state that will be able to provide them the health insurance that they need. So I think that's something that you'll see the smaller companies do, and now it's going to help the smaller companies become more competitive by doing that, because their contribution to the insurance plan will be less. On the other hand, it's going to make them less attractive to recruiting new talent compared to the larger companies who are going to continue to offer their health insurance program. So I think that the mandates for the larger companies, they'll start looking at the cost versus the fines, the new taxes that they'll have to pay. And a lot of them, I suspect, will look seriously at just paying the fines, paying the tax that's going to be imposed on them for not providing health insurance to their employees if they have over 50 companies. So the one thing for sure is a lot of change is going to happen between now and 2014. There'll be a lot of details coming out about the mandates. There'll be a lot of clarification to what the programs need to look like, what the exchanges are going to be. One thing you can count on NSCA to do is to keep you informed every step of the way. We have our government affairs and industry relations blog and website stuff that we're doing that will keep you well educated as to what we know about the best measures and the best steps looking forward to that. So anyway, we'll keep you informed on that. So thanks for the question.